conventional and, I suppose, typical way of measuring a child's learning is academia. If you go away today, please remember, it is great that today we started on a very high aspiration ground, that when the kids are in school, they will get the support. However, if I can take everybody to say, the order of learning is that the way the brain grows, you will start with the primal, you go back to basics. You go back to basics, make sure they've got all their sensory system going. Then you move towards what we call learning. And this very simple fact, if you pin it up on your wall, whenever your child has got an issue about learning, just take a step back and ask, is there some area in their sensory, in their movement, that you can help, that you can work with before you get to the brain? So, what it tells us, and there is evidence, that in this study, 2 years of intervention had shown an improvement of IQ. Yet again, sadly, they measure IQ, but because it's measurable, how do you measure social skills? You can't measure social skills. So, but nevertheless, let's take them on. Let's measure IQ. So, if you do some intervention, you will get somewhere with your learning. So, let's see how this pans out by Dr. Ellen Shaw.
One has to understand the importance of emotion. There has been a transformation in psychology, which was once interested in behavior, then in cognition, and right now we are going through what has been termed an emotional revolution. Emotion is now at the heart of most clinical theories and also of a lot of scientific research. It's at the heart of understanding early development, early emotional development. It's at the understanding of all forms of psychopathology, which I'll talk about in a second. And also, emotion is at the heart of all forms of psychotherapeutic change, whatever the therapy model here. The understanding now is the fundamental nature of emotions in all human interactions. Emotions tell us what is meaningful, what is important. They're also the integration of the mind and the body, because emotions, by definition, psychobiological, the body's reaction, etc. Emotions are also at the heart of how we perceive something as being meaningful. Something is meaningful because an emotional response within us marks that. The body is marking that. So that being the case, emotional development is even earlier than cognitive and intellectual development.
So if you catch that last point, emotional development precedes the cognitive, the intellect. So here, I'm going to move straight on the what. The why is, it is healable, treatable, movable, changeable. You want to change it, and now how? Now, I'm going to try to do a 101 on intervention in whatever time I have left. Usually, if we talk about one type of intervention, it will take you 2 days of workshop. So thank you for bearing with me. But in order that we get to the brain, the more important part is, how do we get to the heart? It's all wired up. There is a certain order of this wiring, and because I state it is so complex, it is very, very complex. But with parental instincts and guidance and your love, you will get there. Let's see. So this is again that 3-wheel of desired learning, the emotion and the social relationship. If you look and focus on this 3 point, it is going to get us back to the definition of what autism is. So Dr. Caroline had given a way of expressing it, and this is my way of expressing it, which is based on the DSM-5. Basically, we are talking about still the social interaction and communication, that there is a deficit, and all the sensory issues expresses itself in unusual behavior. So again, if you're stuck, come back to the basic. What is not going right? Why is not going right is more important. So the iceberg, we love the iceberg. We are consistent in this iceberg because parents, before we can get to that cognitive piece, we have to get to all these other pieces. It's about the emotional regulation. Darwin says that it is not about how clever you are. The survival skills is about how adaptable you are. And it hasn't changed. Whether our brain has evolved, that hasn't changed. So in terms of coming back to autism, there is the delay and there's the deviant. It is not easy if you are a new parent or a teacher just exposed to this. What is this? Is that kid just pulling one on me? Is that kid just having too much chocolate? Perhaps. So having a clear or clearer idea of this will help you find the solutions, will help us find where do we want to intervene, where do we want to put that medicine, which is all the different therapies. I'll give you an example how this quadrant works. Again, bearing on the statement that at least 50% of these individuals in ASD have got average or above average intelligence. I'll just take that as one example. Because of their unusual, what they call behavior, which I prefer to call arousal states. There are many things you can name them, but if you just use your eyes, you may really be doing the wrong thing because that individual doesn't need tuition, doesn't need more tuition hours. They need something else. So again, that spectrum suggests that there will be some who will move on, right? Because some parents say, I didn't do anything. They are right. But some parents say they need more help, and there are some families who will still need help because they haven't gotten to the intervention, or the reality is that part of the brain has been hardwired. So who will do this? So we all agree at this panel, we had the conversation behind the doors. The one who is the key interventionist is the parents. Parents, this is the message that I want to just gift to you because I am a parent and because of my conviction of seeing how Joshua has done so well. We have to be our case manager because we know our child best, and because when you see one autistic child, you've seen one autistic, let me put it the other way, one child with autism, you will see only one child with autism. Why? Because everybody is different. It hasn't changed. That basic message hasn't changed. So within this, the multidiscipline then, from the parents, will then be guided by the health, and this term, allied health, I want to use this here because I understand there are also, it's not going to move. Okay, so within this multidiscipline team, please, in the inclusion of intervention, choose a role that you would love to do. What can you concretely do? I think the key one is recognizing it and accepting it, getting that professional help. Remember, it's the brain. It's very complex. And break it down, because when you have a little individual or a big individual who is full of their tantrum, who's full of their aggression, it's hard to think. Okay, it's really hard to think. So, how do you concretely use it? Go back to basics. Ask grandma, when did, give a name, when did Andrew start crawling? Okay, just ask, because these red flags, these are the things that have been in the family, meaning You don't have to be a doctor. You just need to be a parent or a caregiver. The early signs at school, the early signs can be used in your classroom. You don't have to be special education trained to certification. You just need to care. And if you have the red flags, you will be able to box them in. It's a screening. Now, why do you need the professionals? Because of algorithms like this, which are very important because it shows the complexity that at healthcare level, you can go to Clinic Kesihatan. They are already doing MChats. Here, I just want also to honor the ministries that are supporting all this. It is a sheer cry. It is a desperate cry. There is not enough professionals. Dr. Silva shared today, there is 11 types of specialists in his field in the country. We have perhaps 6 developmental pediatricians in our country. So we have to take some of this on ourselves. So let's go backwards. Too fast? Okay, here you go. So if you refer, you can jump in at the Clinic Kesihatan. You can choose to go to a GP, a pediatrician, a doctor who cares, or many a times parents go straight on to a speech therapist because it's so obvious. If your child cannot string 3 words at 3, 4 words or 5 words at 5, it's a simple measure, and if they don't seem to be moving on, if they don't seem to be changing in their abilities in the 6 or 9 months, it's time to go to see somebody. In school, Ministry of Health have already implemented the Linus screening, which is a screening. Unfortunately, many schools present to families as, how well can my child learn? Which is part of the truth. But I think the intended Linus screening may not be understood by the parents and some schools. It is not just a can I read or how well is performance orientated. It's not. It is to help us really do a first level screening of a child that may be flagged that needs help. There are some of these children who are taken to remedials because they need only a little bit of support, will move on. But if you are one of these loving mamas who spend your mornings every day going half an hour earlier to school and working with that child, and it's still not happening, it's time to send them to a professional. And no amount of tuition. I have to speak this because it comes from spend some of that money on the thing that they need, playtime. That's intervention. Okay, please forgive me if I come across too strongly, but it is really something in my heart. Now, when you get to the professional, the assessment, the diagnosis, who do you get it from? These comes from your pediatrician, possibly a psychiatrist, but the word or the profession that is not very familiar to the Malaysian families is this word called the clinical psychologist. Because we know about the psychologists, you may see them because you have some stress, some depression, but the clinical psychologist, and in particular, educational psychologist, has got a role to help you weed it all out. Remember what is above the iceberg? They will help you weed it down the iceberg. So, after you find that there is something not right, where the brain is wired or not, we have to say, what do we do now? It costs a lot of money. We have to choose our intervention. So, one autism is one autism. One child with autism is one child with autism. I have only 4 minutes left, so what I'm going to do, because the bulk of me is going to show you a flash. We are going to go fast track now. I'm going to speak less, right? I'm going to speak less, but this idea here is to just leave a kind of camera memory bank, okay? Then Google it or find some help. Here we go. Speech. I won't show this. No, I like to show this because this is important. I'll speak less.
we are doing more than just communicating with each other by language. We're also communicating with each other non-verbally through these emotional communications, through face, gesture, tone of voice. These are always going on underneath the language, and these are more critical, actually, for our ability to make contact with other human beings. Someone is always looking to someone else to regulate their state, but cannot auto-regulate their state. It's problematic.
Okay, so it's not about can he talk. It's about can he communicate. Okay, so these are some of the speech type of therapies that involve parents, where you can help look for things that you can do whilst you wait. Even when you have the money, you wait 6 months, maybe a year. That brain is hardwiring, go. Social thinking is another element of speech therapy that's important, because the deficit, remember the definition, is the social deficit. It is not the intellect. Occupational therapy is a key one, but my heart goes into sensory, occupational therapy with sensory integration. We learn about 5 senses, we need to work on the 7. This is a very simple way of knowing why your child is moving, why your child is not moving. And the whole goal of sensory integration therapists is to help the child stay calm, alert, ready to learn. Okay, before that, they are not ready to learn. Don't go to a gym. Go to IKEA. Go to your garden. And I put this out because many of us have got adult individuals, and these adult individuals are still, remember, the brain is still moving, it is still being rewired. Get them to some intervention, get them into movement, which Dr. Eva will share with you, that basic thing, move it. I have to do this because this is a key evidence-based ABA and TEACH, and I know some of the NGOs in our country is using TEACH as a structured method, and I want to encourage you to continue to evolve this piece, because it is again very individualized and they are very community-based, and they are I would encourage that. That's a very personal view of mine. So now I come to classroom. When you are in a classroom, teachers look at the environment. The child needs to be quiet. Look at the curriculum, look at simple things, visual aids, clocks, and just look at how the child, just understand the child. So this is the 101. Photograph this, please, because when you don't have intervention, look at living skills, because it gives dignity, it gives ability, and that's why the child won't feel ashamed or afraid. And then, if they are released from that fear, they can move. The communication piece, the friendship piece, the behavioral goals really are the ones that we are always very worried about, because it's not about the child, it's about us. We are not accustomed to the flapping. Okay, then we moved to academic goals, and now I know that there are already adult individuals in work placements, and we need to support them in vocation. So whatever works is intervention, whatever doesn't work is an assessment, okay? Don't worry, review it. So the journey is inclusion. Honestly, in a way, whether you like it or not, you are included, because it's not going to go away. So consistency is the key, and we have to have a structured way where we are able to put in this intervention. So parents, there are so much information, it is an information overload. Just go back to the basic, go find somebody who will share with you. Parent support group are the best. I learned everything from parents. And this is the message. This is that individual, or 2 or 3. The parents are the first circle. The teachers are really a second circle, because they spend so much time with school. And then there's all of us, the community, the healthcare, the government, the doctors, everybody. You are included. You can't run away. Thank you.